We will now demonstrate the use of the Baxter 300XL syringe pump. The nurse will wash her hands and dry with a paper towel and assemble supplies on a clean surface. Supplies include the syringe pump, the medication syringe, saline flushes, heparin flushes if applicable, alcohol swabs. First thing the nurse needs to do is read the medication label on the syringe to make sure that it contains the patient's name and also checks the expiration date. Release the clamp on the medication syringe extension tubing and leaving the protective end cap in place. Depress the plunger of the syringe to remove air from the extension tubing. It is helpful to hold the syringe upright on a table and press down on the plunger to release the air. Once the air is removed, the syringe is then attached to the pump. This is done by moving the guide to the top of the pump and then opening the clamp to accommodate the syringe barrel. You will notice that there is a slit at the top of the barrel holder that accommodates the flange of the syringe. After the syringe is inserted into the barrel holder, the guide at the top of the syringe is brought down to cover the top of the syringe. It is good to tug on the syringe to make sure that it's tight. Also note the flat side of the flange should be down into the slit on the side of the pump to increase the stability of the syringe. Once the syringe is loaded, confirm that the black button on the back of the pump is set at the appropriate setting. Your label should note if it's a medium, low, or extra low setting. The pump will have been set in the pharmacy. You just need to determine if the button is in the right position. Next, we will prepare to attach the pump tubing to the needleless injection cap. The nurse will cleanse the threaded end of the cap with 3 alcohol swabs, wiping for 1 full minute. Remove the cover from one of the saline syringes. Screw the syringe onto the threaded end of the needleless injection cap and insert the contents of the saline flush using a push-pause method and stopping at the last half cc. Unscrew the empty syringe and discard. Remove the protective end cap from the medication syringe tubing. Screw the cap directly onto the needleless cap. Confirm that all clamps are open. Press the white button downwards to On with alarm. The green light below the medium should be flashing if that's the correct setting, indicating that the infusion is going in via the medium setting. Your infusion will take approximately 30 minutes. When the infusion is completed, an alarm will sound. The nurse will wash and dry her hands and then press the white button to the middle off position. Unscrew the pump tubing from the needleless cap and set aside. Cleanse the threaded end of the needleless injection cap with 3 new alcohol swabs, wiping for 1 full minute. Remove the cover from the saline syringe. Screw the syringe directly onto the needleless cap and insert the contents of the flush using a push-pause motion, stopping at the last half cc of solution. Unscrew the empty saline syringe and discard. If the catheter is open-ended, it must be followed with a final flush with heparin 3 cc's using the push-pause method and stopping at the last half cc of solution. The syringe and tubing is then removed from the pump and discarded. This completes the procedure for the syringe pump.